Year old, the urine dipstick shows glucosuria. Chest X-ray is showing a mass in the left upper lobe, and the biopsy specimen of this is showing the presence of small cells, and the patient is having a Cushingoid appearance of central obesity, round face, etc. So, small cell carcinoma, what are the paraneoplastic features that you typically see? You should remember, non-small cell lung cancer lead to development of hypercalcemia and skeletal connective tissue syndromes. Whereas small cell cancer typically shows inappropriate secretion of ADH, ectopic ACDH secretion, and neurological syndromes, myopathic syndromes, etc., etc. So very happy to see almost 11 students attending this afternoon wonderful session where we are able to revise some of the questions. So only writing tests is a lethargic experience. You take the test followed by a bit of discussion, at least 70-80 questions. Then you are once more energized. So from 9 to 12 you took the test, 12 to 2 you take the discussion, have a nice lunch, have a good sleep, wake up, have a cup of coffee, go to the reading room, and then identify 20-30 topics which you have really gone bad in the today's mock test, NEET PG mock test, and solve those important topics, revise them so that you constantly do these 30-40 Sundays. Automatically when the real exam comes to play, you will be in a position to attack it better. So that is a whole idea. 45-year-old, he is having chronic pancreatitis. Analysis of the stool sample shows 28 grams of fat. So when there is a pancreatitis, what enzymes can become deficient? Lipase is one important enzyme produced by the pancreas that decreases in chronic pancreatitis. Because of the lack of lipase, there is a maldigestion, malabsorption, deficiency of lipid soluble vitamins. Similarly, amylase become absent, peptidases become absent. Patient will develop vitamin D deficiency. Because of that, there is a hypocalcemia, hyperphosphatemia, and that lead to development of osteomalacia. Then there is a hypertriglyceridemia, one of the causes for the development of chronic pancreatitis. So the topic of chronic pancreatitis you must be doubly sure about. A 2-year history of shortness of breath, there is a progressive chest pain, absent breath sounds and dullness on percussion or the right lung base, and the chest X-ray is being shown to you, pleural fluid shows a protein more than 3 grams. A pleural biopsy was done in this person. What you are able to see, doc? You are able to see needle shaped cells, and you can see the thickening of the pleura. So this is a classical example of mesothelioma, is what you have to basically recognize. A 22-year-old comes to the physician, his blood pressure is 150/70. Neurological examination shows a resting tremor. Resting tremor is Parkinsonism. Deep tendon reflexes are 3+, and there is a shortened relaxation phase. So typically this patient is, resting tremor can also happen in Parkinsonism. It can happen in a whenever there is excessive thyroxine, as in the case of the Graves' disease, is another place where resting tremor can occur. So this 22-year-old is shaky, nervous, weight loss. Along with the presence of the tremor, you must be able to catch the clinical vignette of the Graves' disease classically. 62-year-old is having hypertension and receiving thiazides. Thiazides can lead to hyperuricemia. Now, hyperuricemia precipitates gout. And the gout typically presents with warmth, severe pain on the big toe. So, first metatarsophalangeal joint. And you can see that erosive lesions of the gout. So, in this case, what do you want to do? You want to aspirate the joint. First, give indomethacin. Indomethacin is the treatment of choice, which will bring it down the pain, most important. And you do the joint aspiration, you find that needle-shaped crystals of the gout is considered to be a confirmatory evidence of your clinical suspicion. A 23-year-old man, he had been on doxycycline therapy for a chlamydial infection. He is only having single part